The health authorities in the Techiman municipality of the Bunu East region are worried about the increase of new HIV cases recorded in the area. Municipal HIV coordinator Mumuni Mohammed says the prevalence of HIV/AIDS, particularly among young people, has increased within the municipality, recording a total of 925 new positive cases in 2023. And Sabit has more in this report.
The prevalence of HIV/AIDS amongst adolescents and young people is an issue of ongoing concern. It has been established that adolescents and young people represent a growing share of people living with HIV worldwide. While declining amongst all other age groups, AIDS-related deaths among adolescents have increased over the past decade. Here in the Techiman municipality, a total of 15,227 persons were tested in the year 2023, out of which 925 tested positive for the virus. Mumuni Mohammed is the municipal HIV coordinator.
Looking at the situation in Techiman, the current year or the last year, 2023, looking at the raw figures that we have tested or the fight, how we are doing so far, we are able to test about 15,227 people who voluntarily came to the hospitals, non-pregnant women. Either they were suspected by the clinician or they came to the hospital themselves, or we went to the community to test them. 15,227 were tested. And out of this figure, 925 were positives. So when you look at the positivity rate here, out of the number we have tested and the number that is positive, 6.1% were positives.
The youth, according to Mumuni Mohammed, constitute majority of the number of positive cases recorded. This is largely due to their sexually active nature.
The youth, let's say they constitute from 15 to 39 years. The disease is very prevalent among this age group because they are the sexually active, and HIV is mostly transmitted through this medium.
But why is it necessary for one to know his or her HIV status? Municipal Director of Health Services, Dr. Kusi Fosuhene, says the move would go a long way to help prolong one's life as well as protect the person's family.
Knowing your status is not only about you, it's about protecting yourself, protecting your partner, sometimes even protecting your unborn child. For example, if it's a woman who knows their status, they'll be put on the antiretroviral medications. When they get pregnant, we even change the medications for them so that we prevent in utero transmission, so that the mother doesn't give it to that unborn generation. So these are some of the advantages of knowing your status.
He was however quick to caution the general public, particularly the youth, to adhere to the safety protocols and avoid having unprotected sex to stay protected from all sexually transmitted infections.
Apart from HIV-1, HIV-2, we also have hepatitis B, hepatitis C, very common sexually transmitted liver viral infections or diseases, which also I'm sure a lot of people know about hepatitis, so be careful. So maybe you've been even lucky, you are only on one. Because when you're on 1 and 2, even your regimen, your drug regimen may have to change. And then you have hepatitis on top of it. So yes, we know. Some people feel that, oh, once I have it there now, I've been declared, so me too, I'll go unprotected. Yes, you never know who the next customer may even be worse than you.
Anna Sabit, Joy News, Techiman.